Welcome. Let's talk about the 3 question structures, right, of the NCLEX. Every NCLEX question have these 3 structure. We have the body, we have the stem, and then we have answer keys. Now, the stem is very obvious on your NCLEX. It's going to have something like this, right? So this is what the stem. Now, the reason why it's having this symbol is because this is your question. This part is the body of your question, and this is not a question. This is the question. This is for the examiner, right? This is what the examiner is asking you. This is what the examiner is giving you as a pre-information to prepare you for the question the examiner is going to ask. Now, this part is what we call your answer keys. Right. This should give you what? Extra understanding. Most time, if the question is not really clear, right? I teach my students in my course this so well, right? But we are not going to go into the extra understanding part. We just want to talk about the body, the stem, and then the answer key. You can see obviously your answer key is like this, right? Your answer key can be written in various form. It can be written like this. It can be written select order apply. It can be written like bow tie, case study, answer keys. Right, answer key is just where you like select your answers from. Right, so that's one is clear. Now, the body of your question. Now, your approach to preparing for the NCLEX exam should be like this, because the NCLEX, this is how it works. Now, the NCLEX create the exam and they give you the guide. Now, that guide is what we call the test plan. Now, this test plan have the content RN 146 content, PN 150 content. Now, you should have covered all this content before taking the NCLEX exam. Right. A lot of students don't cover the content. They don't even know what the content look like. That's why a lot of students fail the NCLEX exam. Now, if you've covered the content, now when you read the body of your question, you will see that particular content, because NCLEX don't hide the content from the student. The main idea of the NCLEX is not the content itself. They are ready to give you the content that will be on the NCLEX exam, but it's not the content that NCLEX really tests. Instead, they test you on the concept of care. Should I say concept of care or 6 concepts? Now, the 8th client need is what the NCLEX is testing you on as the content. That's where you are going to see that content. NCLEX wants you to be able to see that content, right? Because based on the breakdown of the question, you have your body, you have your stem, you have your answer key. Now, based on that content, you can easily read the body and say, oh, this is what the NCLEX is testing me right here, because you already know the content, 146 content for RN, 150 for PN. Now, but NCLEX is not really about the content. Instead, they are about what? The concept. NCLEX use this concept throughout the exam. So this is what they are really testing you about, right? In any content, this is what they are really testing you about, right? But let's not go deep into that. But let's talk about just the content. Now, the content is what the NCLEX want you to figure out from the body of the question. Now, when I read this question, the child nurse must transfer a female client from the medical surgical unit to the maternity unit to make bed available. Right. This question, the content right here is what we call transfer. That is the content. On the NCLEX test plan, we have admit, transfer, discharge. Right, so this is transfer right here. So that's what the NCLEX is testing. Now, if you have done your own reading, you will find out that we transfer due to various reasons. Right, we can transfer to make further, to give client further more care, right? Or we can transfer to make bed available. Another way, we can transfer stable client, and we can also transfer unstable client. Right, but this question is testing us on what? Bed available. Now, when we transfer to make bed available, who are we transferring? Are we transferring stable client or unstable client? Definitely stable client, because we are making bed available. It means that there's somebody among this list that don't really need care for now, or as much care as others would need. Not really, not that they don't need care, but they don't need as much care as others we need. Why? Because they are what? Stable. Right. So now all I now need to now do is to now look at what the examiner is asking. Right. Now, this is it. Look at what the examiner is saying. It would be most appropriate for the nurse to transfer the client who is. Now, the NCLEX is asking you about what? Most appropriate. Now, we've done the critical thinking right from the body of the question already. Because now we've thought about it. We've said, oh, we need to transfer. And not that we are only transferring, we are trying to what? Make bed available. So, most appropriate patient would be that particular patient that is what? Stable. Definitely we cannot transfer unstable patient because that will not be appropriate. So appropriate patient is the patient that is stable. So all I now need to do is to look at the list right here and what? Figure out that patient that is what? Stable. You can see out utilizing the three structure work. Right. So one, understand the content NCLEX is testing from the body of the question, understand the examiner question, and then go through your answer key and select the correct answer. So this is how the three structure work. You are definitely going to see this three structure in every of your question. Standalone, selected, apply, case study, chart, bow tie. It's there. Right. You just want to figure out the obvious one. The obvious one is your stem. Right. It's your stem that asks you the question, and the stem is going to have something like this symbol. That's the stem. Right. The body as well too will definitely be obvious because the body just gives you like a scenario or a preview of what the question will likely ask you, and then that's where you like spot out the content. Right. And then you have what your answer key. The answer key as well too is definitely obvious. Right. So your content when you are trying to answer question on the NCLEX exam, you are going to see the content of the question right at the body of the question. Now it applies to mostly standalone type question and then select or apply question. Right, standalone type question, select or apply question. Right, to see the content. If NCLEX is testing you, if you're answering like bow tie question, case study, you will not likely see any content because the case study bow tie is not all about content. It's just about your clinical judgment, reasoning, and all that kind of stuff. But your standalone, select or apply, definitely the content is always there. Right, the content is always there. So don't try to look for content when you're answering both type case study. Focus on looking for the content right from the standalone type question and then case study. So this is the end of this mini teaching. I hope you enjoyed it.